Welcome to Menopause the Positive Way, the podcast that inclusively supports Women Plus moving through their menopause journey with greater ease, control, and an empowered mindset. You can subscribe to this series wherever you get your podcasts. Brought to you by Positive Health, making life easier and helping you make a change for the better.
Good morning, Positive Health listeners. This morning, you are going to have the benefit of a fabulous conversation with Dr. Alison Schmidt, who is the CEO of Unconvention and host of Unconversations, a podcast where C-suite leaders, executives, industry pioneers, elite coaches, and athletes unpack the unconventional decisions that shape how they lead and live. Her work is based on a simple but often overlooked reality. Most leadership frameworks fail under pressure, not because leaders lack strategy, but because leadership is fundamentally human. Based in Dallas and working globally, Alison is known for saying the thing most leaders are thinking, but won't say out loud. So good morning, Alison. How are you today?
Good morning, Dr. Edwards. It is amazing to see you again. I am just thrilled to be here this morning, and thank you for the honor of being on your podcast. Thank you so much.
And thank you for being a podcast guest today. I'm really excited to have you. And before we jump into our conversation, I gave a very brief bio. So can you please tell our listeners a bit more about your career and what you're doing these days?
Yeah, absolutely. So I rebranded my company. I had a strategic coaching company called ALS Group. We rebranded to Unconvention, and we collaborate with CEOs, founders, entrepreneurs, and like you said, we really help executives move through complex issues that are going on in their business. We also help CEOs as they transition from one opportunity to the next and making sure that they know what their next opportunity looks like and feels like. And we also work with really helping those clients of ours really get through high pressure, high demanding decisions that are organizational, as well as they could be personal decisions in helping those leaders move forward. We also help those leaders identify what they really need as their leadership skills in order to move not only their employees forward, themselves forward, as well as their organizations. And you also mentioned Unconversations podcast, which Dr. Edwards, I had the great pleasure of having you as a guest on my show, where we really identify what makes these individuals unconventionally excellent. I have them define what that actually means for themselves. And one way we do that is I bring them through my baby called the Unword Effect, which you did fantastic. And I loved your Unwords. And we really identify what their unconventional journey looked like to what made them successful as they are today.
Okay. Well, without further ado, since Positive Health is about all things menopause journey, can you tell us a little bit about your personal journey during this stage of life?
You and I definitely talked about this on my show. I have a wonderful doctor who I've been seeing here in Dallas for over 16 years. And we have been talking about menopause for a long time before I was even in the journey. I just saw other people go through menopause. I saw my own mom go through menopause. And there were certain symptoms that I didn't know what they meant or looked like, but I knew I didn't want to go through it to the best of my ability. Mm-hmm. And so I have been talking to my doctor. So we sort of had a plan in place. So when I eventually got to a certain age, that this wasn't going to be a new conversation that she and I were gonna have. And so I am now 55. And so I took my first hormone test. I think it was 51. And the reason why things were quite delayed for me was because we were dealing with COVID at the time.
Okay.
Yeah. So that's why I was just
Yeah.
like, I do not want more than what I need to deal with right now. So I was dealing with COVID and menopause at the same time.
Not a good combination.
Right. Most people are talking about their business going through COVID, and here I am like, oh my gosh. So that's why I want to clarify at the age. So I took a hormone test, and that did definitely show that I was in perimenopausal. And so we talked about what that plan looked like. And for me, at the age of 16, I have always been on birth control. And birth control for me originally was to help with cramps, other issues pertaining to menstruation. And but because of that, that was helping as I was sort of getting into the age of my menopause journey, if you will.
So I really want to emphasize for anyone who's listening today, because I think what you said is not the usual in terms of your having been thinking about this for a long time and having discussions all along the way with your clinician. And we had talked previously about how atypical your relationship is with your clinician and this whole journey that you're on compared to what it is for a lot of people. So if you could delve in a little bit more about that.
Yeah. So I have always been raised to advocate for myself. And so with all my doctors, I have always come in with a slew of questions. And if there was any pushback, I would just like, okay, I still need to find out this answer, or I will look and find out the answer myself. And so I have been very fortunate that through doctors that I've had, when I left to go to college, and I will tell you, I was not always as fortunate in having insurance. So when I was in college, I will tell you, I went to Planned Parenthood. And even with Planned Parenthood, I still spoke to them about all aspects of my health. And I was always an advocate in talking to them about what it was I was feeling, what I felt like I needed, because I felt that's the only way a doctor is really going to be able to help me, is the more that I can explain my symptoms, my concerns. If I saw a study come out or something, I would be like, hey, what's this study about? Does this affect me? Or how do I need to respond to this? And so when I moved to Dallas, I asked for a referral, and that's how I found my doctor. And luckily, she is a holistic doctor. And so I wanted to make sure I'm not one who likes to take a lot of medications at all. And so if there is something I need to take, I do want to know, what the side effects are, what the purpose of it is. And the most medication I've ever been on was, as I said, was birth control. You spoke about advocacy and that part of it. Throughout my menopause journey, I was feeling cramps. And so my doctor took me off birth control. And she said, hey, I want to try you on these hormones, specifically menopausal hormones. And that did not respond well to my body at all. And she was a little confused because at my age, cramps is not usually something that someone in their 50s would necessarily be talking about. It was not common, but I'm like, I am feeling this. Like I'm feeling these things. And so she went ahead and took me off of that. And she said, hey, before I put you back on a birth control to help manage your menopause journey, I want to make sure that we do some diagnostic tests just to make sure that we're not dealing with some other internal issues that are going on. I said, great. Sounds perfect. And so nothing was found. Thank God. Everything was fine. And she went ahead and put me back on a very, very low dose of birth control to kind of help me continuously through my menopause journey. And last year, she said, okay, we now are going to take you off of everything. And there was a bit of nervousness with me around.
I would imagine after all those years.
Right. And I know there's a lot of brain and body that have to kind of talk to each other. So I understand that. But this is something that I've just done for so long. So knowing that I was no longer going to take anything was a very scary thing for me because my body, fortunately, as you and I have talked about, has really worked like clockwork for me. And so that's been working out, that's been diet, that's, been taking the birth controls we talked about. So this was all very like, oh my gosh, it wasn't a dependency for me. It was just something that has just been part of my life. And so there was almost like a sadness in a way when she was like, we're going to take you off of this. But what was rest assuring for me was when she said, hey, if there's anything that comes up, I want you to talk to me about it. There is no reason that you need to suffer through any pain, or if there's anything that seems unusual to you, I want you to reach out to me so we can have those discussions.
So I'm glad that you brought up the whole area of birth control pills because I think it is something that is not at least discussed any place that I'm listening most of the time as being a potential option for hormone therapy during this stage of life versus the regular menopausal hormone therapy. So I think that's an important point for listeners to be aware of. And it also serves the purpose of ensuring almost 100% that you aren't going to have a surprise that you don't want. But I think it also points out that there are lots of options out there. And so it's important for each person to have a conversation, hopefully have the type of support that you did to work things out over time. So I think that you also had some symptoms that were not the usual that people hear about or read about when it came to your oral health.
Yeah. It was this. I have always had sensitive teeth. And it was one of those where I don't know, last year just seemed like I'm eating something or drinking something. And the sensitivity was just, it was enough for me to really notice a change. And I'm obsessed with my teeth. I am obsessed.
There's a story there, I'm sure.
Right. We'll get to the psychology behind that in a minute. Obsessed. And so I use Sensodyne and I floss every day and mouthwash. And I went to my hygienist in December And she's like, hey, normal. How's everything going with your teeth? Do you have any concerns about anything? And I said, I just feel like my teeth are really more sensitive than they have been previously that we've talked about. And she asked me, she said, hey, are you in menopause? And I said, yes. And she said, oh my gosh, that is really very, very, it's a very common symptom and one that is not discussed enough. And so she recommended that I do some sort of dry mouth, have that be biotin or something, and kind of bring that into my routine because that could help with making the sensitivity a little bit more easier to handle. And I do have to say that it has definitely helped me. But, and I did, Google it like everyone does, where they get their highest, medical, advice from. And I was just like, is this something that is common? And it is common, but not necessarily really talked about. And so that was something that was just fascinating to me. She said that there are more and more studies that are starting to come out about that, but it's still not just a common. It's common that it can happen. It's not commonly discussed.
Right. And there are many areas like that, including your eye health as well, with the dry eye and some changes in vision. So I think that when you're having a bunch of new weird symptoms and you're going through this stage of life, something else could be going on, but the menopause journey should be a consideration, and do like you've done to talk about it and find out about it and figure out what it's all about. But now I'm extraordinarily curious about your obsession with your teeth. So tell us.
Yeah.
Tell.
That should have been your Ask Dr. Allison question on my podcast. You didn't know, though. So the obsession with my teeth is when I got braces very young. They didn't have all the really cool, fancy. So I had the metal ones where, you almost look like Frankenstein in a way. And so the orthodontist is expecting a teenager to try to take floss and try to weed it through these metal type braces, which was never going to happen. It just wasn't going to happen. Maybe as an adult, you're probably more disciplined to do that, but as a teenager, you're not. And so when they took my braces off, it was horrific. I had inflamed gums. Just it was horrible. So it scared me. And so at that moment, I literally became, I'm talking like obsessed. So when I go to the dentist, it's almost like, did I get my gold star? Even as a 55-year-old. So yes.
Okay, that makes sense. What's really also interesting and funny is that the old metal braces are actually making a comeback, and now they can be cool now.
Well, listen, they need to. I hope it improves the flossing ability. As long as it does, then they're going to be in great shape.
Okay. So, one area that I think would be important for people to hear about is what, if any, impact you're going through the menopause journey. And granted, yours has been a lot easier than for some people, but the impact on your relationships.
Yeah. So you and I talked a bit about this. So my wife, she has not had the best journey when it comes to her menstruation, and things have not really been great for her. And so she, I want to say, when she was making a medical decision for herself to help with these cramps, what she was looking to do could go ahead and put her in early menopause, which we both said it can only be one at a time. And, so, and because of our 7-year difference, I won. So right. So that's how that
cramps.
right. So that got right. So so she went ahead and got a partial hysterectomy. But the good part about that is, one, she really did not want to go into early menopause, in all seriousness. But part of my brain was like, oh no, I get this first. So age over beauty gets to go first. So yes. But it's been really helpful for us to talk about things, because we do talk about things medically. I mean, it could be like I was even talking to her about my teeth, and so
of course.
So she right, she knows that. We'll get that solved in December, I promise. So we get it solved. Yeah. I did tell you we're both Aries, so we got to like calm each other down at times. But what's been really nice about it is, we actually met when she was really going through. She's receptive to fibroids, and that was really kind of a big issue. And so we also know that in your sometimes early to late 40s, your menopause journey can start. But we really wanted to really not have her start that unless that was really something, and going for a full hysterectomy if that's what she chose to do. But I think for us to be able to talk about these things, and for us to be able to listen to each other, because I will say there probably have been sometimes I probably have gotten overly emotional about things and maybe didn't really realize that. I have talked on my podcast before where I have suffered from depression and anxiety. So I'm not sure if in those moments that going through my menopause journey has sort of, bubbled some of that up a bit. And I've heard, I've talked to other friends who have felt like that they've, have had depressive type symptoms or anxiety type symptoms that their menopause journey has been. So I think it's really nice that I do have a partner that will, check in with me, making sure that I'm okay. Or if I am feeling something that seems a little off balance, we're very supportive of, hey, let's talk to a doctor, about that.
Okay. Well, and you were talking about depression and anxiety. I'm glad that you brought that up, because even though things have gotten a whole lot better, I still think that there is a degree of stigma and taboo when it comes to mental health conditions.
Sure.
And during the menopause journey, people talk about mood swings, which some people do get, but just by virtue of going through, as you suggested, if you've never had depression or anxiety before, you can have new onset because of the hormonal changes. Or in your case, if you've had it in the past, then it can trigger an exacerbation. So all these different things that seem to be coming out of the blue, once again, do what Alison does. And think about the possibility and have the confidence to have the conversations. And you had also mentioned some of in your particular case, but mindset and culture can have a big impact on how people view this time of life, whether it's a positive, a negative, if it has special connotations. And those things can obviously also have an impact on your symptoms, your experience. So do you want to talk a little bit about that as well?
Yeah. There's a few things culturally, and let me know if this is sort of the direction that you're wanting to go. From one standpoint, my wife is Hispanic. So going to the doctor culturally is not something that you necessarily do, and it could be for many levels. It could also be majorly for financial. And my wife has, when we met, I mean, she's worked for very large companies where uh, insurance is not an issue. So we're very fortunate. We have a PPO plan where, and even before me, she had a PPO plan where she could really go anywhere. Now, getting her to use it
Mm-hmm.
would be a different story because of um, her either fears, culture, idea about medical. Uh, my wife was very fortunate when she and I met that she had a doctor who she absolutely adored. And she was an OBGYN. And she fortunately for the doctor, unfortunately for her, retired.
Yeah.
Yeah, and so she was really devastated about that. And I tried to get her in with my doctor. She was not taking any new patients on, but I did ask her for other referrals, which I think is really important. If you know someone's going to a really great doctor, referral sometimes is really the best because this person, and especially if you trust this person, and they really like, and they've been with them for a while, and they like their bedside manner, and they take care of whatever they
Mm-hmm.
listen to them, whatever they, that you're really wanting from a doctor. And so she actually went to another doctor who she absolutely adored. And 3 years after that, ended up moving up into hospital management. so,
Okay.
so she went through that whole sort of journey again. So, what I think what's been really hard for her is being able to start over and find a
Mm-hmm.
doctor once you sort of trust that doctor. And she's gone through some referrals before. 2 doctors ago. And she feels that she is treated differently when she goes in
Mm-hmm.
there. And I mentioned this to you on my podcast. I understand my privilege,
Mm-hmm.
and I understand the color of my skin, and I also know how I was also raised, and so I know that those are all factors that have also made my journey a bit easier because
Mm-hmm.
I go in and have always advocated for myself. And I don't really care what the doctor thinks about me.
Mm-hmm. Mm-hmm.
Really, we should be caring about my health and why I'm there. And so I think that's an area that both she and I have talked about. It's still very hard for her. It's very hard
Mm-hmm.
for her. And I think insurance has gotten even harder. So being able to learn how to navigate through a
Mm-hmm.
very complex system, even though you may have the best insurance possible, it's easy to be brushed off and just making an appointment or, you know, going through billing or whatever the case may be. And so, after a while, you're just like, all right, this isn't worth it. And it needs to be worth it because
Right.
it's your health.
Right.
That's why it has to be worth it. And so I we talk about that a lot because, and I give her the confidence. Sometimes we'll talk about how to phrase certain things where she can really get what she needs. And it's sad because it shouldn't have to be. It shouldn't have to be that way,
Right.
but it is in many cases.
Yeah. Definitely. Definitely that the bias, the medical gaslighting, much more prevalent for certain groups, and women of color are one of those groups, and it definitely shows in lots and lots and lots of ways, including what you had stated in terms of people becoming very reticent about that next appointment even. And when you combine it with the experiences that women can have related to the menopause journey, plus that, then it can be a very, very challenging time when you don't need to be challenged in any way, and make it harder and, to your point, just unnecessary and completely unacceptable, in my opinion. But
yeah. I mean, I 100% absolutely agree with you on that.
You had also mentioned the reaction that you had gotten from some of your friends when you talked about being on birth control. So I think that's something that people might be a little bit surprised by.
Yeah, well, I was also going to bring too, I think that's a great segue, because I was also going to talk about, you're not just talking about culture, but there's also religion too that can come into play, and which I've always believed in separation of church and state. Mm-hmm. And I also believe that there needs to be a separation of church and medical. I really, someone can have their own preferences in their personal life, but I do not believe that religion necessarily needs to be involved in medical decisions, or even in my medical decisions. But, birth control, as I've even mentioned to you, Dr. Edwards, is, the name birth control. And so that already gets people just in a tailspin, because why are you taking that? Even just regardless of me being in a lesbian relationship, just why are you taking, birth control? And so where are you not wanting to have kids? That's where that drug, in my opinion, always gets directed to, when that birth control is used for so many other ways for women. And so there needs to be so much more education around birth control, in my opinion. And there's so many different levels of birth control. I mean, there's tons of them out there. I mean, I probably have had more adjustments with birth control than I have through my menopause journey, because not all birth controls are exactly the same. And so some of them could have very different reactions to different people. And so there have been some that have just been absolutely awful for me. I mean, I was on this to help with cramps, and now I'm having 3 times worse cramps than I had before. Like, get me off of these things, and so then I would be on a different, so birth control is not just a singular drug.
One pill and that's it.
There are so many of them, and that's the level of conversation. And it has side effects just like any other medication out there. And that's why that's really important to talk about how that particular birth control is affecting your body. And if it's something that can be adjusted, then it can be adjusted. And that's just a level of communication having with your doctor. What's fascinating to me is, when you're sitting around with a bunch of other friends and you're having a glass of wine, and, when you get older, medical things always seem to come up when you get older. I was like, oh, yeah, I hurt my foot and I went to the doctor. You weren't talking about that kind of stuff when you were 20 or 30. But when you start getting your 40s and 50s and older, it's like, hey, how's everyone's health and medical doing? Seems to be kind of the question. But there was an interesting topic where we were talking to a group of friends, and this was before even my menopause journey. And the conversation even came up as I was in my menopause journey, that I was on birth control. And people were absolutely shocked by that, one on the previous side, because they were like, well, you're in this relationship with a woman. She can't get you pregnant. Thank you for letting me know. I was like, well, yeah. Norm and I joke about that on a separate level, but I said, well, of course, I understand. But, and that just, that shows, we had a good laugh about it like this. But when I explained the reasons why, it was a very shocking revelation. And it was also the same level of conversation that I had through, as I started my menopause journey. And then it was even more shocking when I said, hey, I was on, this, menopausal specific pill, and my body said, we do not like that. And then I ended up getting switched back over. And again, that was a very mind blowing sort of experience, for them, until I was able to really, explain that. So what tells me too, in that community, that the education around birth control needs to improve as well, because it can be a very effective, drug to use. One, for cramps, it has for me. And two, it could also be used, as you and I talked about earlier in the podcast, that it could be used in reducing, some of, the menopause symptoms that a particular person could be going through. And so, for that education, it may not work for everybody. That's why there's so many wonderful things out there. And that's why, as you mentioned, as well, Dr. Edwards, that the menopause journey is a personal one. And it's your journey. And not everyone's journey may be the same. And there could be, some commonalities between my journey and someone else's journey. So I think the education sort of around, birth control. I think I told you, I think they need to change the name of it in some fashion, because I find it to just be so narrowly, focused in one thing. But it can really be used in so many other ways, in helping, a woman as one option, within their health.
For sure. And it's interesting that you talk about all the different formulations and how some worked for you and some definitely did not. There actually is a female founder who's doing a study about any trends and patterns that she sees behind why certain birth control formulations may work better in some groups versus others. So I thought that was interesting. And there are certain drug classes where the impact may be different. And for example, with antidepressants, certain antidepressants work better in women, and different drug classes may work better in men. So medication is another one of those things that I think that is, people in general, including in medicine, don't think about that to the degree that may be very, very, very helpful. And that's a lesson that I have learned up close and personal in some of the medication adjustments my mother has had to make. So I have learned a lot going through just what she has had to go through in certain instances.
Sure.
I know you.
Yeah. I want to just say this last part, if you don't mind. The other thing, I think is important, and please let me know if this is an accurate statement. But something that I did, with my doctor when I was 20, or something that I took when I was 30, or something I took when I was 50, my body is changing metabolically, and so I could be on something, a birth control, for example, that worked great for me. It worked great for me for 3-4 years. And then all of a sudden, I'm like, what is happening? Like, this has been my godsend. What's happening?
Right.
And, for me, my doctor, explained to me, hey, your body's, changing. She used this O word where she said I was getting older, which I didn't really appreciate. I was all like, what? And so, yeah. And so I said, okay, great, thanks. So she informed me of that. But your body's changing as you get older, I was told. And so certain things that worked for you at a certain age, and because of your body changing, we now need to look into something that, and that's when she said, usually my patients who get to this age or whatever have experienced certain similarities that you're going through. So let's go ahead and make an adjustment and see if this, if this particular medication works better for you. So I think that's really important because, something that may be working, it may not have just stopped working because of the medication itself. It's just how your body is constantly changing, as I've heard, when you get to this older stage of life.
that you're told about but know nothing about.
Right.
Which takes me to, I'm glad that you brought that up, actually, because as I mentioned before, mindset can have a big impact on your perspective, your experience, and even for some people, the severity of their symptoms. And, the studies are out there about certain cultures, certain societies where this stage of life is not a negative, is actually viewed as a positive. And when I think of someone having a positive attitude about the journey, you're definitely on the list of people that I think about. So why do you think that you have the mindset that you have? How did you get to that point, and what advice do you have for others who may be feeling afraid or dreading it, or just feeling like their world is topsy-turvy and they'll never get any control back?
I think the beginning part is, I think when my mom would probably tell you a very different story about her menopausal journey, but my sister and I agree that we have different perspectives about that. My sister is 3 years older than me, so I'm a little lucky where she will get to a certain part in her life, and I can kind of talk with her about that. So I guess this is going to happen regardless. There's no way I can stop it. So that's one thing. So it's going to happen regardless of my attitude around it or not. And two, I even without having Norma, I have always wanted myself to not live in pain. So I think the biggest thing is, what do you want for yourself? And if knowing that there's help out there, I think is really important. And for example, your organization. And so for me, I just knew that I don't enjoy pain, but I also don't like taking a lot of medication. And so for me, it was very important for me to work with someone who is holistic in their thought process. And so that, and I think too, when you asked me earlier about symptoms, I've always been a hot sleeper. So, I probably lately have noticed more where I'm really kind of sweating more, at night than probably I have. So, I'm just kind of riding the wave with certain things. And so I think knowing that I have a doctor that, I can talk about if there are issues that are coming up, that I know there is relief out there. Two, I think you have to have a really good sense of humor about some of this as well. And, I have friends that I can, joke around with, and stuff. But at the end of the day, we're also there to talk through and support. And, I was having, cocktails with a colleague, and we just happened to, again, health, because you get to this certain age, and we were having cocktails, and I said, I have to go, I'm going to be going to the doctor, and whatever. And she actually started her menopausal journey earlier than I did, and so it was just like, oh my gosh, let me know what your doctor has to say, or, if you don't mind sharing your results with me, or things of that nature. And I was like, yeah, absolutely. Yeah. I mean, yeah, of course. And I think the more that I'm not afraid to talk about these things. So if part of what I can help friends, colleagues make this more of an open discussion than just a silent journey that everyone needs to go through, then I feel like I'm doing my part, because I feel that as women, we need to be talking about these things. We need to be supporting each other, and we need to demand the health care that we deserve to have. And specifically with the menopausal journey, it's not one that we get to pick and decide. If we get to, Dr. Edwards, you need to let people know. You need to let people know if that's gonna, if they get to choose, because but as far as I know, it's one of those, we don't get to uncheck that box that we don't want to go through it.
Not
so
yet, anyway.
I think, yeah. So I think that's where, I think that's why I've been able to keep such a good attitude about it, if that answers your question.
Okay. And so you talk to leaders in organizations, you talk to people in the C-suite. I know that you have strong feelings about menopause in the workplace. Now, in your particular case, you have a fabulous boss who's very good to you.
Yeah, she can be a little tough at times, but for the most part, we get along pretty well.
But what about people who aren't as lucky? Any advice for them?
You and I talked a bit about this too, and I think I think we need to be able to talk to our coworkers. I think we need to be able to talk to our boss that, hey, if we're just not feeling great, can I please work from home? I mean, we need to be able to have these open discussions around what this is, because when we're on our period, we can talk about that. That seems now to be more okay to talk about, because you're going to, asking one of your coworkers, hey, do you have a Tylenol, an ibuprofen? Do you have a pad? I mean, it seems to be much more open in talking about that than probably it has ever been. And I think menopause needs to get to that same level, that, hey, I'm feeling this way, or can I have certain things at my desk that's going to make things more comfortable for me? As I previously just said, can I work from home? We need to be able to talk to each other about what we need, because if we don't, that's what affects productivity. That's what affects somebody at work. Then if they're able to be in bed with a heating pad, an ice pad, whatever, and they can work comfortably, you're going to get more productivity out of that employee than having them suffer at work where they cannot get the relief that they're needing. They're just waiting for the clock to get to 5 o'clock or 6 o'clock so they can get the hell out of there and go home and take care of whatever their health needs are. And I think we need to be able to have those open discussions, have that be through ERGs, have that be with your boss, coworkers. And I think another aspect you and I also addressed is I think we need to support employees with most menopausal treatments are diagnostic. They are not preventative because menopause is not preventative. And so there's a financial cost that when employees go to the doctor, we'll just take a hormone test, just for example. You can go and get a hormone test, and that is considered diagnostic. And that has in most, I'm assuming most insurances, unless there's something that's been added to your employee insurance plan, that is going to be an out-of-pocket expense that the employee is going to have to pay for. And I think organizations can do a much better job in making sure for women that as we see preventative things are covered, but also I think it would be wonderful and very proactive of companies to make sure that a woman's menopausal journey is also covered, because I think you will get higher employee retention, you're going to get higher productivity out of that person, and you're going to have a much happier employee.
Well, and I look at this as what you're saying, that talking about your period, and the other area is pregnancy. I view menopause where pregnancy was decades ago. I just am hoping that we don't have to take the decades it took for pregnancy to get where it is today in terms of how it is looked at and addressed in the workplace. And there actually is some movement there, although most employers still don't have menopause specific programming. But there's now legislation, and it really widely varies as to what the legislation said. But there's legislation now, I think we're up to 26 states, and some of them do actually address coverage, prior auth, workplace accommodations. So crossing all body parts that we can turbocharge through this and not have to repeat the decades that pregnancy had to. So I guess
I agree. The last thing I wanted to say kind of around that, if you don't mind, is, I think this is something that women should not wait to bring up with their employers. It should be something that they are constantly talking with HR about, saying, what can we do? Because it's up to it can also be up to the organization on what kind of leaders they want to be as well, with taking care of their female employees. And so not just to sit back and wait for something to happen, but to really talk to the people within your organization and really getting them to think about how important this is from a business strategy and from an employee retention aspect and a productivity. And so it may not change overnight, but there's no reason that female employees cannot start today in advocating for healthcare also around this issue.
Well, and I think that it's important for women to realize that it's not just about the management of the symptoms they're going through by virtue of the hormonal transition, because there are estrogen receptors all through your body. As estrogen is dwindling, you are at increased risk for a host of physical and mental health conditions that you were not before. So this is not minor, because it's impacting you in terms of symptoms now, but it's also impacting your future health. You start to see people now with diabetes, hypertension, heart disease, osteoporosis, etc., depression, anxiety, and some of that is part of getting older, but a lot of it during this stage of life is this spike in your risk. So from that perspective, it also makes sense for an employer to be paying attention to this area also.
Absolutely.
So I have loved our conversation as I expected I would. Just wanted to ask if there are any last words you want to share, thoughts you want to share, advice, guidance to the audience out there.
Well, first of all, I thank you for allowing me to be on the forefront of this discussion. I love one. I love talking with you. I love what you are doing, advocating for women, especially around the menopausal journey. It is it's such important work. And there's so many women, socioeconomic, cultural, and who just need a lot of education, because this can be it can be a scary time if you're not really understanding kind of what's happening to your body and why it's happening. And as you said, I have been very fortunate through my journey, but I have witnessed and seen other people who have not been as fortunate. And I think because of there being either a lack of education around it, not taking the steps to seek out relief, and whatever that relief is for them. And you and I are very much on the same page. Is as women, we do not need to suffer. And we're not saying that the journey is going to be smooth sailing and there's not going to be discomfort or anything to that degree, but just knowing the different options. And once you're on an option, if it's not working, you can change to a different option. So it's a journey. It's called a journey for a reason. And so the journey can have some twists and turns and some ups and downs. But just knowing that there is help out there, especially like your organization, for example, I think it's really important to drive that home.
Okay, well, thank you. Listeners, I think you can tell from this conversation why I really wanted to have Dr. Schmidt on. And if you want to have more of this type of energy, tune into her podcast. Alison, do you want to just give a little blurb about your podcast?
Oh, thank you. Yes, the podcast is called, as Dr. Edwards said, the Unconventions podcast. It is actually wherever you get your podcasts, on YouTube, Spotify, Apple. We interview global leaders from all over the world, to our founders, CEOs, industry pioneers like Dr. Edwards, and we release episodes every week.
Okay. Well, thanks so much again for being a guest, and thanks for all you do to advocate for women.
We are so glad you joined us for this episode of Menopause, the Positive Way, and hope you will share this podcast with friends and family. You can subscribe to the series wherever you get your podcasts. Along with this podcast, Positive Health also offers a holistic, one-stop digital health experience supporting your body, mind, and spirit during the menopause journey. If you or anyone you know is looking for guidance, education, and services that address the many symptoms and needs experienced during your menopause journey, you can become a member, and you can join by visiting our positivehealth.com website. That's PAUSITIVE health.com, making life easier and helping you make a change for the better.
This is an educational podcast where the views of our guests do not necessarily reflect the views of Positive Health. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Positive Health does not provide medical advice.